When taking a blood pressure reading, it is important to have the patient in a calm setting, with both feet flat on the floor and their arms resting on a flat surface at heart level. The next step is to find the right size cuff. When sizing cuffs, it's important to know there are different sizes. While a regular sized cuff works for most patients, some may require a larger or smaller cuff. The width of the bladder in the cuff should be at least 50% around the bicep. The length of the bladder should be at least 75 to 80% around the bicep. Most blood pressure cuffs have an arrow or circle that shows you what portion of the cuff needs to be placed over the brachial artery. The brachial artery starts at the axillary region, crosses over the arm in the antecubital fossa, and extends to the thumb on the lateral side of the forearm. Make sure when placing the cuff to place the side labeled "this side against limb" against the patient's bicep. Now you are ready to place the cuff. Proper technique includes beginning with a palpable systolic blood pressure because it provides you with a target on how high to inflate the cuff. It will also prevent you from being misled by the oscillatory gap. We will explain the oscillatory gap in a moment. Place 2 fingers on the radial artery to find a pulse and slowly start pumping up the cuff. The cuff should be inflated until a pulse is no longer felt. At this point, inflate the cuff more quickly, about 20 to 30 millimeters of mercury above the point. Then start letting the air out at 2 to 3 millimeters of mercury per second. When 2 consecutive beats are felt, this is your systolic palpable pressure. Now we can take the blood pressure. It is important to make sure the stethoscope is set to listen through the diaphragm when taking a blood pressure. The setting can be changed by twisting the chest piece. The earpieces of the stethoscope should be placed in your ears, pointing forward toward your nose. There are 5 phases of Korotkoff sounds. It is important to listen for phase 1 and phase 5 of these sounds. Phase 1 is the loud, clear sounds first heard when the cuff starts deflating and the vessels start to open. This is our systolic blood pressure. Phase 2 is where the oscillatory gap occurs. The sounds in this phase become softer and may seem to disappear. Phase 3 is when the sounds become crisper and louder again. Phase 4, the sounds become muffled again, and phase 5 is when the sounds completely disappear and where we find our diastolic blood pressure reading. Without a palpable reading, there is the possibility that we may start deflating the cuff while the patient is still in phase 2. If this were to occur, we would hear the return of the sounds in phase 3 and think that the patient's blood pressure is lower than it actually is. To recap, the first sound you hear is the systolic blood pressure, and the disappearance of sound is your diastolic blood pressure. Now that we know what to listen for, let's take the patient's blood pressure. First, ensure that the air release valve is tightly closed by twisting it all the way clockwise. Place the diaphragm over the brachial artery in the antecubital fossa. Inflate the cuff until you reach 20 to 30 millimeters of mercury above the palpable systolic pressure reading. The cuff can then be slowly deflated at 2 to 3 millimeters of mercury per second, listening for the phase 1 and phase 5 Korotkoff sounds. The needle may begin to bounce as you deflate the cuff, but this should not be used to represent the patient's blood pressure as it can be inaccurate. If the patient's blood pressure is not at an appropriate level, a second blood pressure is recommended. It should be taken 5 minutes after the first, and the other arm may be used. A normal blood pressure in adults is less than 120/80. A patient is considered to have hypertension if their resting blood pressure is greater than 140/90. Hypotension is a reading that is less than 90/50, or if the patient is symptomatic. Oscillatory devices are considered the gold standard, but oscillatory devices have gained popularity because of their ease of use. Devices worn on the upper arm are considered the most accurate. Several agencies have evaluated the accuracy of these devices, and the results can be seen at the link in the slide above. It is also important to read the manufacturer specifications and know the limits for cuff circumference and blood pressure detection. It is important to know that in the special situations listed above, it may be difficult to obtain an accurate blood pressure. In some instances, taking an orthostatic blood pressure can be useful. First, take a blood pressure while the patient is sitting, and then repeat the measurement with the patient standing. Be prepared to support the patient. A drop in systolic pressure greater than 20 millimeters of mercury or a drop in diastolic pressure greater than 10 millimeters of mercury is indicative of orthostatic hypotension.